Hi, my name is Anisha Azad and I am from Woodinville High School. My topic today is physician-assisted suicide, subtitle, A Lesson in Embracing the Discourse. The key concepts of this lesson are deciding the difference between assisted suicide and suicide, the different ways people can access assisted suicide, and the debated ethics of legal assisted suicide. Skills that students will acquire in this lesson are the insight of the steps needed to safely and legally carry out assisted suicide, the ability to know your death with dignity rights, and the understanding of conflicted assisted suicide views. The main focus of this lesson is to highlight the process and the steps of assisted suicide, along with the ethical and moral debates that follow them. This lesson probably should not be for any student under the age of 14, as it does deal with dark and sensitive topics such as like the imminence of death. I decided to do this topic because I understand there are a lot of misconceptions surrounding assisted suicide, and it's a very important topic. A lot of states are or already have seen initiatives in the past 10 years for the topic of making it legalized, so I thought it was an important thing to focus on. Hopefully in this lesson, students will have a comprehensive and perceptive outlook on the controversy and the science of physician-assisted suicide. So the lesson will have just two distinct components. One, the description of the technique and the conditions under which it can be performed, and the opinion and the contention surrounding the matter. The materials needed are chairs, whiteboard, and the printouts of the worksheets that are provided. There are two main components. The first component, purpose, is to gain the knowledge of the insight of the steps needed to safely and legally carry out assisted suicide. The time estimate is 25 minutes. Begin the lesson with an open-ended question: is there a best way to painlessly end one's life? Allow the students to discuss for 2 minutes, and while they're discussing, pass out worksheet labeled Worksheet 1. After they've discussed for a bit of time, continue the lesson by stirring up the conversation about what the students think the condition should be and who should be able to get it, assisted suicide. After they've discussed for a bit, relay to the students where physician suicide is actually legal. The states that have it legalized are California, Colorado, Oregon, Vermont, Washington, Washington, D.C., and Montana. Discuss who is allowed to receive assisted suicide through the use of a seminar, just real quick again. Allow the students to discuss and have a consensus on what they believe should be allowed. After they've done that, tell the students the following information. All patients must be 18. Patients need to get 2 oral requests from a doctor, physician. They need to be able to write a request to the physician, and the doctors that are involved must decide if the patient has less than 6 months to live. Assess the students on the knowledge they just obtained by asking them to complete Section 1 on Worksheet 1. To finish Component 1, we describe the step-by-step process of undergoing an assisted suicide through the eyes of a patient. Before we do that, we need to discuss the difference between assisted suicide and suicide. Suicide is when a person is physically healthy, as in they do not have a terminal illness giving them less than 6 months to live. It's a sudden interruption of life, and it's not advised by doctors. While assisted suicide, the person has an incurable ailment or a terminal condition, and it's an acceleration of imminent and certain death, and it must have approval from many doctors. While you're discussing step-by-step, have them fill out Section 2, Worksheet 1. So the step-by-step of the process is, Step 1. The first is in person, orally ask a doctor if they will assist you in your state's death with dignity law. Step 2. 15 days later, a second formal oral request must be made, along with a written request to a different doctor. There must be 2 witnesses at the time of the written request. Step 3, both doctors must confirm the patient has less than 6 months to live. Step 4, a third doctor must prescribe the drugs 2 days after the written request is approved. The drug most commonly used is pentobarbital, which costs about $125 for the lethal 10 milligram dose. Step 5, in the home, which leaves that one healthcare worker present, the secobarbital is given to the patient through the grinding up into a soft food such as applesauce. Step 6, after about 10 minutes, the patient begins to slip into a coma, and within 48 hours, the patient passes away in their sleep. The next component deals with the ethics and the morality surrounding the two opposing sides of the assisted suicide debate. The estimated time is 25 minutes. In order to gauge the opinion of your students, draw an imaginary spectrum from one side of the room to the other. On one of the spectrum is for those who unwaveringly believe that the physician-assisted suicide should be legal, and on another end is for those who wholeheartedly believe that the practice should never be allowed. Advise students to line them up on the spectrum according to their beliefs. After they have done this, have them sit back down in a circular seminar and have them complete section 1 of worksheet 2. After this, have them seminar for about 5 minutes. If debate becomes too heated or passionate, take control of the seminar and lead it to another direction, such as discussing the pragmatic reasons for not or allowing the practice to happen. Next, draw a two-sided chart up on a whiteboard, one side reading supporters and one side reading non-supporters. Under the supporter side, write the following, bulleted. 1. Tremendous pain and suffering of patients can be saved. 2. Patients can die with dignity rather than have the illness reduce them to the shell of their former lives. 3. Loved ones can say their final goodbyes while the patient is still able to understand them. 4. Vital organs can be saved because the machinery to preserve organs can be around at the time of death, allowing doctors to save the lives of others. On the non-supporter side, write the following. 1. It could open the floodgates to non-critical patient suicides and other abuses. 2. Government insurance companies may put undue pressure on doctors to avoid heroic measures or recommend that assisted suicide procedure miracle cures or their recoveries can't occur. Doctors are given too much power, and that can be wrong or unethical. Repeat the spectrum activity and note if any other student's position has changed. Have students complete section 2 of worksheet 2. With such a dark and heavy topic, it's very easy to understand if people are sensitive to certain topics of the area, which is why maybe it's not good to have somebody younger do this. But I thought it was really important to do this topic because in the past 10 years there have been a lot of changes to the legalization of this field, and students who are about to be voters, I think it's important to have a lesson plan for them to be educated on the topic because soon they'll be deciding the future of it. Thank you.